Hi, it's Dre Griggs with Obsidian Wisdom. Today we discuss your top 10 Medicare questions. We're going to go through a series of Medicare questions. There'll be some examples, some workshops. We'll go through and try to demystify Medicare. It really is unfortunate how difficult the government makes many of the programs to understand, to implement, to sign up. There are so many options and moving pieces when it comes to Medicare that we really are trying to figure out what is the best choice for me. And when it comes to your overall healthcare coverage, it is easily one of the top three concerns that we have. The majority of people are concerned about rising healthcare costs. And we'll go through some of the numbers and we'll answer the 10 questions today. There's so many questions that we can probably do this at 10 of 10, or we'll find a name for the series at some point in time. But let's start with the basics. Question number one is, what is Medicare? Medicare is a federal health insurance program that is offered by the United States government, and it is traditionally for people who turn 65 years of age. There are some exceptions for medical conditions and disabilities where someone younger than 65 can have access to it. It is traditionally known for Parts A and B, that's considered the original Medicare, but you also have Part C and Part D that was added more recently. There's also different ways to talk about Medigap and different things, but that is not actually a part of Medicare. And so we'll go through Medicare Part A, B, C, and D throughout this video, and you'll be able to get a really good idea of what Medicare is and what it isn't, what it covers, and how much it costs you. Question number two is, when am I eligible for Medicare? For the majority of you, you're going to be eligible for Medicare once you reach 65 years of age. Normally, your enrollment window opens 3 months before you turn 65 or 3 months after you turn 65. As long as you're enrolled within that period, you don't have to worry about any of those penalties where it may increase your monthly premium of Medicare Part B by enrolling later. But at 65 years of age is when you become eligible for it. Now, there are some people that may have medical conditions or they have some sort of disability where they can access Medicare as well, but earlier than 65 years of age. Question number three is, what is the difference between Medicare Part A and Medicare Part B? Medicare Part A, which is generally referred to as hospital insurance. It covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. The nice thing about Medicare Part A is the majority of people don't have to pay any sort of a premium. Most of you are already going to have the 40 Medicare credits necessary, so you don't have to pay any sort of a premium for that one. Medicare Part B is known as medical insurance, and that covers certain doctor services, outpatient care, medical supplies, and preventative care. Most people will pay a monthly premium when it comes to Medicare Part B. Question number four is, how do I enroll in Medicare? And so there's a couple ways that you can enroll into Medicare. One is you may have already been automatically enrolled. If you access your Social Security before you turn 65, then you're already automatically enrolled in Medicare. Otherwise, you're going to want to enroll by calling a 1-800 number, and I'll put that underneath on the bottom, or you can go into your local Social Security office and you can enroll there. You can also go into the website and you can enroll through the website. I'll put a link to there as well. Now, it is worth noting that you may not get the penalty if you are still working past 65, you are at a company that has at least 20 employees, and they offer an acceptable healthcare plan. Normally, if that describes you, then you don't have to worry about enrolling in Medicare at 65. But if you're not working somewhere where there's at least 20 employees and they don't offer full health care that you're enrolled in, then it makes sense for you to enroll at 65 so you don't have to worry about any of those penalties. Question number five is, what does Medicare Part C or Medicare Advantage cover? So Medicare Part C is that private coverage Medicare where what happens is private companies are able to reach out and build their own network. And if you pay them directly, then you have access to that network. It is worth noting that you must get your care within the plan's network of doctors and hospitals unless you have an urgent or emergency situation. You still have Medicare Part A, you still have Medicare Part B, but normally they have a few additional benefits. In this situation, you probably could have a dental, a vision, a hearing added to your plan. You can also get your Medicare Part D or your prescription drug benefits through a Medicare Advantage plan as well. Question number six is, what is Medicare Part D and how does prescription drug coverage work? So Medicare Part D is your prescription drug coverage and it's designed to help you pay those prescription drug costs. Medicare Part D is offered by private insurance companies, but it is regulated by the federal government. But with that said, the costs and the coverages will vary plan to plan. For you to be able to have Medicare Part D, you have to already be enrolled in Medicare Part A and B, or you have Medicare Part C, the Advantage, and then you added it to it. Now, it is worth noting that if you go without credible prescription drug coverage for any continuous period of 63 days or more after your initial enrollment period, that's that 7-month window we're talking about, you may have to pay a late enrollment penalty. The penalty is calculated by multiplying 1% of the national base beneficiary premium by the number of full uncovered months you didn't have Medicare Part D or credible coverages. The national based beneficiary premium can adjust and go up. In fact, the 2024 numbers, they went up about 6% compared to 2023 numbers. So it's just as far as understanding that 1% premium is going on top of whatever the actual base is. So you may end up paying more depending on how long you end up waiting. Question number 7 is, what is the cost of Medicare Part A? The good news is for most of you, about 99% of you, you won't pay any premium whatsoever. You have worked the necessary amount of credits, paid the necessary amount of Medicare taxes, where you don't have to worry about paying the monthly premium at all. So congratulations on that. Now, if you're in the 1% that does have to pay it, in 2024, it was $278 or $505 each month, depending on how long you and your spouse worked and paid Medicare taxes. It is also worth noting that you would have had to sign up for Medicare Part B. That's the one that does have the premium, to be able to access Medicare Part A. And if you don't sign up for Medicare Part B within that 7-month window, then you're going to most likely have to pay some sort of a penalty. And then we mentioned the penalty is about 1% of what that average base amount is. Question number 8 is, what is the cost of Medicare Part B? Now, that amount depends on the amount of income that you have, but for the majority of people who make $103,000 or less a year as an individual, or $206,000 as a couple, you will pay $174.70 per month. That's what most people are going to pay. If you make over 103 for an individual and up to 229, then you would pay $244.60 per month. You'll then see that if you make from 129 to 161 as an individual, that you will pay $349.40 per month. And you'll see the largest amount is if you make greater than $500,000 as an individual or $750,000 as a couple, that you will pay $594 per month. And so what you'll see is your premium can adjust based on the overall amount of income that you are receiving. Now, this amount for most people is normally going to be deducted from your Social Security payment. So if you were going to get a payment of $2,174.70, then they would have deducted the $174.70 that was your Medicare payment, and then they would just send you the $2,000 each month. So it's not something that should normally be billed. Now, if you're not someone who is taking Social Security benefits, then they would send you the bill quarterly in the mail, and then you would make your Medicare payments for Part B based off of that. Question number 9 is, can I have both Medicare and Medicaid? So for those that don't know, Medicaid, the way I try to remember it is I say aid, like aid to help someone. So Medicaid is the financial needs one, and then Medicare is the one that happens when you're over 65. So if you're someone who has a financial need, then yes, you can have both. If you qualify for Medicaid and Medicare, you can have both. The way your Medicaid will work, working with your Medicare, is it actually would help you pay some of those additional premiums. You do have co-insurance in Medicare, and you also just have some expenses that Medicare doesn't cover. Well, your Medicaid may help you with making those payments, so they work together. It's not something that you have one or the other. You can have both. And then question number 10 is, do I need supplemental insurance, also known as Medigap? And Medigap, we'll do a completely separate video on Medigap because there is a lot of information there. But a lot of people do take advantage of Medigap because it just helps cover some of the overall expenses. For example, many that do enjoy the Medigap coverage is normally going to help them make their payments on their deductibles, their co-payments, and their co-insurance. It just makes payments that your Medicare Part A and Part B don't normally cover. All right, that is it. That is our first batch of 10 questions about Medicare, and we have so many to go through that it's kind of crazy when you really think about it. But if the government doesn't make it confusing, then why would the government make it at all? So we will go through a lot of your Medicare questions. We'll go in detail. We'll show you examples, and we'll go through the information to help you create your own healthcare prosperity blueprint. It is a part of the overall wealthy retirement plan, but I'm going to give you everything you need to be able to make that decision on your own, because my goal is to help you make an informed decision that feels right to you. If you found value in this video, go ahead and give me a thumbs up and like. Let me know that you appreciate this information so I can make more videos on Medicare. And if you have any additional questions, put them in the comment. I'll add them to my next list and I'll be able to answer them for you. As always, thank you for your time, and remember, stay safe and enjoy life.